So good morning, everybody, and welcome to this week's updates vlog in terms of events and festivals within Warwickshire. I'm delighted for you to join us today. As usual, I've put on our slides at the beginning just to show you the indicators that we've been looking at and working with since March of this year in terms of where we are on the prevalence rates within our districts and boroughs across the county as a whole, in terms of our more vulnerable groups, where we are in terms of hospitalisation and capacity, vaccinations, and of course where we are in terms of new variants. Absolutely delighted to be joined this morning by Emily van der Venter. Good to see you, Emily. Hoping you're well.
Yeah, good morning. Doing all right, thank you.
So shall I hand over to you and you can give the updated figures and where we are with those areas?
Of course. So I'll just share my screen now so I can give you the data update. I just thought I'd start off with this one in terms of just giving that picture of the regional situation. So you can see along the side here, actually most local authorities are seeing an increase, and our significant increase we've had in Warwick district over the last week or so, pushing us up to 140 per 100,000, one of the higher figures in the region, well, in fact, the highest in the West Midlands at the moment. So just to look at our district and borough rates more closely, so you can see for Warwickshire, we're at 92 per 100,000, so above our indicator that we had set, so some caution around that. And you can see each of the district borough rates are rising, and Warwick district there in the orange rising very rapidly, as I say. So links there to outbreaks within our student populations, but not all cases being in that age group. So you need to bear that in mind. We've got the vaccine coverage figures here, which I wanted to share with you. So pretty good for the over 50s, but still some way to go for those younger age groups, of course. So that just means, obviously, with the outbreak amongst younger age groups at the moment and the lower level of vaccination coverage, we will be feeling quite cautious about events for the younger population. So I know, Jonathan, you would be talking about, if you've got an event coming up soon that is for that younger age group, really thinking carefully about all your control measures and if there's anything else to put in place, and we can certainly support you and have discussions around that. So if there's anything you want to add on that point, Jonathan.
I think you make a really good point on that, Emily. The big concern really is how quickly those rates have gone up, and particularly gone up in that age range, probably between about age 10 through to about age 30. We're seeing those prevalence rates going up quite sharply. We do know, obviously, that that's a lot connected to the fact that schools are operating in a slightly different way. Because obviously the exam elements have finished. There's a bit more freedom, but we also know similarly with student population and connections with that social interaction within the younger age range is definitely having an impact on that. So yes, definitely our view at the moment, looking at where the rates are and how quickly they've risen, then we would having a lot of caution over events that would be being planned in the coming weeks. And if you are thinking of planning an event anywhere in the county at this moment in time, we would absolutely urge you to speak to your local district and borough, or you can contact us direct. We'd be more than happy to join you in a meeting just to talk through your plans and how that would be looking. Emily, if you were looking at plans right now, would there be particular things that you'd be asking event organisers to have in place?
Yeah, so I think a key thing is really looking to see whether they can implement lateral flow testing and requiring a negative test for entry into an event. Many of our event organisers have been happy to put that into place, and actually we've worked with an event organiser recently to ask that they up that to look at PCR negative results, and that is because of the current student outbreak and the fact that they would be receiving a number of people of that a number of students at their event, so hence wanting that extra level of caution. I mean, that's not something I suppose I would necessarily expect as standard, but certainly LFTs are a really helpful way to go to just help. No test is absolutely 100%, but it will help to minimise the risk in terms of then those going into the event.
Yeah, I think that's really good advice. And I know that a number of operators, event and festival operators we've been talking to this week have even gone down the line of introducing PCR tests as well and using that as a point of entry. And of course, PCR tests are much more accurate in terms of their assessment. So if people were looking in terms of organising the event or festival over the coming weeks or months, I would definitely suggest come and talk to us. And we could see how we could support you. Emily's been fantastic on things like mobile testing units that we can use in certain areas. We've got good expertise, good local knowledge, so very keen to help. The other thing I'd say definitely is in terms of the step 3 arrangements at the moment, as I'm sure people will know, step 3 guidance is a maximum capacity of 4,000. That doesn't mean tickets sold, that means people attending. And also it's 50% of the capacity of the the venue.
And whichever is lower, is that right?
Whichever is the lower. And if you were talking to us today, one of our challenges would be in terms of those numbers, whether it is right to go with those maximum numbers, or are there ways of actually bringing those numbers down, create greater space between people in order to make sure that we minimize any particular spread. Yeah. So that would definitely be, wouldn't it, Emily? That would be where our guidance would be.
And looking to minimise time spent indoors. So, outdoor events are certainly lower risk. Admittedly, even outdoor events will, there'll be toilets and closed spaces that people have to go into, really looking at the flow of people there. I think something else that's come up as well recently is thinking about transport to the events. So if you're busing people in, that's going to present an additional risk. And if anybody on that bus later tests positive, we'll be looking to isolate everybody on that bus, so it could have quite a significant impact. So really encouraging people to make their own way there in smaller groups would be preferred. If there's no other option, again, come and talk to us and we can help you make some plans around that. I wanted to touch on, I suppose, the other indicators. So we've got an indicator around rates in over 60s, and actually we are seeing very small numbers of cases in the over 60s now, as a result of the vaccination programme, I've no doubt. So it's any support, I suppose, that event organisers can give us to help encourage vaccination uptake is greatly appreciated, and again will help make your event safer. So vaccinations are now open to everybody over 18. We've got pop-ups which will be roaming the county over coming weeks, so people can have easy access there. You don't need to book, just walk in. Obviously, if you're invited by your GP, take it up. And 2 doses is really important with the Delta variant. It does, you need maximum protection from those 2 doses. So please help us with those messages.
Yeah, I think that's really, really well said, and completely echo that. Anything that people can do to encourage others to get their vaccinations, and there's still a stubborn minority that we're just struggling to break through. So if you can really help us with that, that would be absolutely amazing. I suppose my last comment to operators in the coming weeks was also about record keeping and information on people who are attending events. We've seen great examples where event organisers have a pre-booking system where people actually have to register their name, their details, and the name and details of anybody else who's attending with them as a group. That's vitally important for us, because if there is an issue or there is a problem where there is someone does test positive, it's those records which are so helpful for us to then do the backward tracing and making sure spread is minimized. So please look at how you're taking your records and your information on people who are coming to your event. If you can use a pre-booking system, and you can use it to take the details of everybody who's attending, not just the person who's booking the tickets, that would be really helpful, and the use of QR codes as well is really helpful, making sure people use those QR codes. And again, everybody who's attending, not just one or two people within the main group or main party. We do have occasions where people are taking handwritten records of attendees and their phone numbers. Very sadly, we have to report to you that there is a number of occasions where people are giving false phone numbers. And that, of course, makes our job really difficult, because if there is an outbreak, we then cannot get hold of everybody who may well have been at that particular event or that particular venue. I think it's probably somewhere between 2 or 3 out of 10 times we are finding that is the case, which actually, if you think about it, is actually quite a high number. So please be very, very rigorous about how you record people's names and details. And if there's anything else you want to add on to that, Emily, at all?
Just, as you said, really, it is absolutely vital to enable us to do that contact tracing and reduce further spread. So please do. It is ultimately the event organisers or the venue owners' responsibility to make sure accurate details are collected. So I know that presents a challenge in itself, but actually you have the right to refuse admission if you believe people may be giving false information. So yeah, please help with that.
Good. I think that's we'll end it there. We've had lots of these broadcasts where it's been really good positive news. Very sorry to bring slightly more concerning news, but the way to deal with this is by working together, and we all support each other. We're here to help. Please contact us if you need any advice, and in the meantime, we hope to your planning and your event goes well, and we're here to guide you in any way we possibly can. So thank you very much. Thanks, Emily.
Cheers, Jonathan. Stay safe.
Okay, thanks. Bye bye, everyone.